it spreads very fast.
And now that health physicians themselves are confirming to us that there is a shortage of vaccines, especially for, the treatment, would you say our health facilities, our infrastructure is capable of handling this outbreak?
Okay, so the first thing I need to clarify is that the cholera vaccine is a preventive thing. It is not for treatment. And the environment and our personal hygiene has a very critical and major role to play. So when we say we have vaccines for a particular disease, it is not too good to hide under the fact that, okay, we have vaccines, so I can be careful or be careless with my personal hygiene. So that is not correct. It is not good. So in as much as we have been told that the vaccines are in scarce supply, do you even know, even if we had it 100%, the vaccines do not give you 100% protection. At the best, it gives you about 80 to 85% protection. And as the time goes, because for adults, the duration is for 2 years, it wanes. It goes as low as 60%. So people should not look out so much for the vaccination, but rather let us emphasize on our personal hygiene, hand hygiene, what we eat. Like they said in one of the flyers circulating for behavioral change communication, if you cannot peel it, if you cannot cook it, then leave it. So for fruits, vegetables, anything that is going inside your mouth, you must ensure that it is very clean. You should be able to cook it. You should be able to have, when you're eating it, it's very hot because the cholera microorganism is heat labile. Once it's very hot, the temperature is very high, it denatures it, it kills it. So we should rather emphasize on that rather than the vaccine. The vaccine is a 2-dose vaccine that you take at start, then within 6 weeks, you take the second dose. However, even at its peak, it gives you about 80% protection, which wanes as the time goes.
Right, Dr. Okon, there are some people that whenever they have any mild feelings, some feeling of fever or anything, they resort to, over-the-counter product, or they resort to self-medication. But in case of this cholera outbreak, this bacteria, what are the signs and symptoms do you think one needs to look out for so that one would definitely present him or herself at the hospital?
Okay, like I earlier mentioned, it is an acute diarrheal disease. It causes diarrhea, which is simply explained as loose and frequent stools. So by the time someone is going to the toilet frequently, we all have our toilet habits. There are some people that once they go to the toilet in the morning, till they come back from work, till the next day, they do not go again. Some maybe twice. But in all this, it's not meant to be loose and watery. So by the time you have frequent stools, 3, 4, 5 times, and it's loose and watery, and particularly in the case of cholera, there's something that is characteristic about the watery stools. We call it rice water stools. So it looks like that color of the water that you drain when you're parboiling rice. That is about the color that you get. That is the major thing. However, there can be vomiting. Fever is neither here or there when it comes to cholera. And by the time, in the human body, you have over 70% of fluid. By the time you stool so much and you lose so much fluid and electrolytes, you start feeling very weak. You can have cramps. Those other symptoms are things to watch out for. But majorly, like I said, it is loose, watery stools. And classically, it is said that we watch out for the age above the age of 5. Because we know under 5, children have this stooling, vomiting here and there. But above the age of 5, so the cutoff age is 5 years and above. However, because we are having an outbreak, anybody that is having loose, watery stools and very frequent, please present yourself to the nearest hospital so that they can find out what exactly it is, especially to prevent dehydration, which is what kills very, very fast.
And there are concerns about cholera spreading in schools. Help us understand how teachers can identify some of these symptoms in children, and also how some schools, can be ready to address the situation.
Like we did in the days of COVID, even by the time they started opening schools, I remember in my children's schools, as you're getting in, you wash your hands. I think we need to reactivate that hand hygiene thing. For the symptoms, it still goes to the diarrhea. So when you see a child in class and the child is appearing a little weak, and by the time you further investigate to see that the child has been stooling a little bit and maybe has had some medications coming from home or something, because when children, especially because of their immunity that is not as mature as those that of adults, when they stool, just a little stooling a few times, they are so weak and lethargic. They are not able to participate actively in normal activities of the school. Then the teacher has to watch out. The child may take excuse to go to the toilet. By the time the child is going out of the class more frequently, you need to watch out for that child. By the time the child is putting the head on the locker too frequently, the child may be weak to diarrhea. So these are the things to watch out for in the school environment.
Absolutely. We hope that people heed most of the advice and the professional information that you've actually given us regarding this. President-elect